Welcome back, Pain-Free Living. My name is Dr. Andrew Gorecki, owner of Superior Physical Therapy, and today we're talking about all things shoulder pain, and my goal is to try to help you learn how to heal naturally and avoid medications, injections, and surgery. So I want to start in this segment by kind of telling you a story of somebody I just actually met a few days ago. I had a patient come in and see me who's been struggling with shoulder pain for over a year. Let's just give him the name of Mark. I can't really tell you who it is because that would be a HIPAA violation, but we're going to say Mark came in and saw me Monday morning, and he's been struggling with shoulder pain for over a year. And currently he's got pain in his shoulder when he moves in any direction, but really bad when it's overhead. He also gets a lot of nighttime shoulder pain, and he really has been trying a lot of things. In fact, he's got a list of 12 things that he brought in to share with me that he's tried before meeting me. And so you can imagine that he really has lost hope. He doesn't feel like anything's going to help him. Yet he doesn't want to have surgery. He doesn't want to take medications. He wants to heal naturally, but he doesn't know what to do. So number one is when he first got injured, the first month and a half, I believe he said he just rested. So he said, I'm just going to rest. I'm not going to do a whole lot of yard work or housework. I'm not going to clean things. I'm not going to play sports. And I'm just going to rest and see how that goes. And it didn't get any better. In fact, it got worse. His next step was he went to urgent care. Urgent care gave him a sling. So let's just rest it and we'll put it in a sling so it's not moving. So we would call that like an immobilizer. He did that for a few weeks and then again, that just got worse. Then he moved on to, went and saw his doctor and he got pain medicine and anti-inflammatory. So we talked about that earlier, how pain medicine really just alters the brain's perception of pain. Anti-inflammatories really just alter the body's ability to heal because inflammation is the second phase of healing. As you can see in this chart, we have 4 phases of the healing process. Inflammation is number 2, so we need it to heal. And we really need to think before the injury or the stress, the damage of the tissues. That's really where we need to focus, which we'll talk about later in the show. So all that stuff failed. Then he went in and got injections. He got a series of 3 injections into his shoulder joint, and the injection was what would be called a corticosteroid. So again, a stronger anti-inflammatory, but in the area that's causing the pain. Didn't help him, unfortunately. And we also know that, again, that's just altering the problem, but really there's more evidence coming out that injections in the shoulder actually start to deteriorate some of the ligaments and the tendons. So that can actually make things worse if you do too much of that. So that's why he only did 3. Then he started to try to modify his activity. I call it avoiding or activity avoidance, where he said, okay, I'm going to make a list of all the things that make me have pain and I'm going to stop doing them, right? So he stopped doing his work chores that he normally did. He got a different, he got put on like what would be called light duty, I guess. And then sleeping was something that was challenging. So he started sleeping in a recliner, which I actually hear from a lot of patients that are struggling with shoulder pain. It actually helps the pain go away while they're sleeping. But man, I'll tell you what, when we talk later in the body about how the other parts of the body actually contribute to shoulder pain, sleeping in a recliner makes things way worse from a long-term perspective. And then again, he had more visits with the doctor. He ended up getting an x-ray, which showed some arthritis in his shoulder, then which again, most people are having as you age. But it wasn't severe. It was actually the lowest minimal arthritis for his age at 50. I think he's 50 or 52. And then he went and had an MRI, and the MRI shows that he has a partial tear of the rotator cuff. And then he got another drug called gabapentin, which is actually just a nerve conduction velocity changer, so he doesn't feel as much pain. He actually tried physical therapy as well, so I was excited to see that. I'm a physical therapist, but when I started talking to him about the things that he had done in physical therapy, it was all focused on his shoulder joint. So heating it up, cooling it down, massaging it, stretching it, strengthening it. And his response to me was, that was actually making me feel worse. Which, gosh, you know what? That a lot of times, if we're gonna move the part that's already injured and hurting, that doesn't make a lot of sense, does it? If you had a cut knuckle, would you just keep bending your knuckle and stretching it and massaging it and heating it up and cooling it down? No, you wouldn't. You would let it rest. You'd let it heal. So oftentimes, you need to take a bigger perspective and look at how the entire body's functioning and what's actually causing the shoulder to be painful. And then finally, he went and saw a surgeon. So we went and had the surgical consult. The surgeon said, yep, the MRI shows there's a partial tear and we can do surgery if you want to. So you just let me know when you're ready. So now here he is coming to see me with this big long list of things he's tried. He's losing hope. He thinks surgery is the only answer. Everything he's doing is just altering the situation. Nobody's actually found the problem that's causing the stress and the damage and the inflammation and fixing the problem.